Good day to everyone and welcome. My name is Claire Kilpatrick. I'm a global health consultant and I'm a member of the International Federation of Infection Control Scientific Committee. It's a great pleasure to be here with you today with Weber Teleclass along with IFIC to introduce you to Joanna Esteves Mills. This teleclass has been organised by IFIC as part of the IFIC 2026 Infection Prevention and Control Masterclass Series. IFIC is a global federation of infection control societies and professionals working together to promote best practices, strengthen capacity, and improve health outcomes around the world. IFIC's mission is to lead global IPC by promoting evidence-based practices and strengthening educational resources and opportunities across all countries. And that's why we're delighted to be with Weber Teleclasses today and throughout the year. So back to our speaker today. I've been lucky enough to work with Jo for a number of years now, which has been a great opportunity to cross-fertilise our thinking with regards to hand hygiene improvement across healthcare settings, as well as other institutions. Jo brings a wealth of experience to this work and to our class today. She's a global public health consultant working with the World Health Organization in Geneva. She's a WASH specialist and has worked in a range of contexts with particular experience in the interface between evidence and practice, and also with an interest in the political economy of development. Jo holds an MSc from the London School of Economics and Political Science and previously worked with the London School of Hygiene and Tropical Medicine and WaterAid. And as such, again, Jo and I have great crossover, having worked with all these organisations at different times. So it's my great pleasure to hand you over now to Jo. Thanks, Jo.
Thank you, Claire. It's a great pleasure to be with you all today. I hope that the slides I have here are of interest, and please do not hesitate to be in touch if you would like any more information about any of the aspects presented here today. I've been invited to present you with information on new global guidelines published by WHO and UNICEF jointly last year on the 15th of October on Global Hand Washing Day. These are guidelines on hand hygiene in community settings. And we'll get into this a little bit more down the line, but I think it's important to say it up front and now, and probably a few times throughout, that these guidelines really focus on settings that are not handling primarily with healthcare delivery. And so they are community settings, everything outside of the healthcare setting. As you probably know, and with great thanks to Claire and other colleagues, WHO is very well served when it comes to guidelines on hand hygiene in healthcare facilities, and those are separate to what I'll present today. So just a quick overview of what I want to touch on. I'm going to briefly touch on the context for these guidelines. Then I'm going to go into the guidelines themselves and share with you the recommendations within them, the guidance that they provide to UN member states and their partners, and then talking briefly about implementation of the guidelines going forward. So why hand hygiene now? There are just a few things I want to touch on, most of which I'm pretty sure you'll be well familiar with. Hand hygiene is a daily part of each and every one of our lives. But there are some figures that I think are worth mentioning and highlighting to support as we continue to advocate for greater resource investment and greater consideration for hand hygiene within broader areas of work. So firstly, hand hygiene is life-saving. Each year, 740,000 people die of infections that we know could have been prevented with hand hygiene. And this really probably is the tip of the iceberg. These are the diseases that we can measure, that we have sufficient evidence to be able to put a figure to. So diarrheal disease and acute respiratory infections, namely. But we know that hand hygiene can affect a number of other diseases as well. For diarrheal disease, it's responsible for about 30% of diarrheal deaths across the world. And for acute respiratory infections, 17% of deaths. And you can read a lot more about this in the publication that I've noted on the right, The Burden of Disease Attributable to Unsafe Drinking Water, Sanitation and Hygiene, published by WHO in 2019, and also by the Lancet paper that is referenced there. The second thing is it's not only life-saving, but it's cost-effective. And whilst it's quite difficult actually to do detailed cost-effectiveness analysis on any health intervention, there is some data that indicates that hand washing is on a par with oral rehydration therapy. So really very cost-effective. It's not an expensive intervention, and it's something that will yield really, really high returns. Thirdly, the third point I want to make in this context is that there is global commitment to enabling hand hygiene. Here we have the Sustainable Development Goals. Now, hand hygiene actually features in a number of these, not least the target on health, but specifically where it's measured and where governments have a commitment that they aspire to attain by 2030. Target 6.2 on sanitation and hygiene has commitments to achieve universal access to basic hand washing facilities by 2030. But there's also global commitment to achieving it in the emergency and the pandemic preparedness world. So we know that obviously we had COVID-19 not too long ago, and during that time there was a resurgence of interest and focus and investment in hand hygiene during the early period of the pandemic when it was believed to be a key preventative measure. Since then, we know that the WHO pandemic agreement, which was signed just last year, features a strong focus on water sanitation and hygiene and infection and prevention and control measures, including hand hygiene. And this builds on the international health regulations published 2 decades before, which has a similar focus on prevention, including through hand hygiene. So we know it's important, yet progress is lagging. And the latest joint monitoring program on the report on this is shown on the right. It tracks progress on household drinking water, sanitation and hygiene. This is an initiative that is led by WHO and UNICEF, and it really enables us to quantify the extent of the problem and also in many regards the extent of progress that we're making over the years towards the 2030 SDG goals. And we know that in 2024, 1.7 billion people still lacked a hand washing facility with soap and water. So this is a basic requirement. It's linked to a basic human rights of access to water in the household. It's linked to basic human rights to health and dignity. And it's something that 1.7 billion in the world today don't have access to in their house. And nearly half of these people live in sub-Saharan Africa, a quarter of them in Central and Southern Asia. And we know that there's much more of an issue in rural than in urban areas, with 3 out of 5 of those people living in rural areas. We also know that achieving universal access by our target of 2030 would require a doubling globally in current rates of progress. And if actually we're looking at least developed countries, where we know the burden is highest, the burden of disease is highest, and where we know access is lowest, access to hand hygiene, we'd actually need to have an 11-fold increase in progress rates in these countries and an 8-fold increase in fragile contexts. So this is the context in which these guidelines are important, because what we were able to see during COVID-19, when there was a big surge in interest for global guidance on how we could accelerate access to hand hygiene facilities, how we could increase behavioral adoption of hand hygiene, we saw at that time that guidance on how to accelerate has been unclear or lacking up to date. And so WHO commissioned in 2021 a scoping review of existing global guidance, really to see and understand what was out there already that could help meet this upsurge in demand for clear evidence-based guidance. You can see on the right, this is the publication. Was published in a peer-reviewed journal in BMJ Open, and it's the results of this scoping review. And what we were able to see during the scoping review is that guidance really, firstly, is not sufficiently evidence-based. So we were able to pick out 53 pieces of global guidance, so documents that provide guidance on hand hygiene, 923 recommendations within those 53 documents. And we were able to see the extent to which those recommendations and those guidance documents provided the evidence base for their recommendations. And fewer than 10% of those recommendations, those 923 recommendations, had cited evidence. Perhaps even more worryingly, there was significant discordance across the different documents and across those different recommendations. There were also gaps in guidance. So there were areas where there simply was not sufficient global guidance to help guide governments to strengthen this area. Specifically, we saw discordance and gaps on what products are effective at removing pathogens from hands in different contexts. We saw gaps, or we saw discordance on the technique, and in particular on the duration that how long you should take to wash your hands, essentially. And we all know that, especially during COVID-19, people were being encouraged to sing happy birthday twice. We know that there's this rough parameter of 20 seconds. Well, actually, when you look into global guidance, there's significant discordance in that amount of time, and it wasn't necessarily backed by the evidence. There were also question marks across existing guidance on what the water quality should be for hand washing in order for it to be effective, and much, much more. I won't go into it here, but feel free to access the publication. And the final point is that there was very little on really how governments can improve hand hygiene. So thinking about not just what needs to be in place, what products are required, how long you should wash your hands for, all those things, but also how can governments move from the current status quo to a situation where their population is washing their hands regularly and has the wherewithal to do so. And finally, this scoping review showed that most recommendations are for an emergency response rather than for ongoing development. So that's the context in which we sought to develop new global guidelines, really to address those areas of discordance, to address the gaps, and to equip member states and their partners with guidance that could really support them to achieve that acceleration which we've seen is necessary in order to reduce the health risks that we see. So moving now to the guidelines, what do they recommend exactly? And crucially, I think, on what basis do we make these recommendations? So firstly, I just wanted to highlight some of the key aspects of the guidelines. This is a sort of, if you don't read the full document, here are the sort of takeaways that you should take, and perhaps they'll be enticing enough to attract you to reading the full document. So what's different about these guidelines compared to those 53 other global guidance documents that we talked about, that we reviewed? Well, firstly, there's this real emphasis on government responsibility in enabling hand hygiene practice. So often we think of hand hygiene as a private behavior, something that really would protect your own health and that you are responsible for doing, with potentially some guidance on when and how to do it provided by private soap providers or to some extent by governments and health agencies. Actually, what these guidelines do is they position hand hygiene as much more of a public good. So thinking about the impact that community level hand hygiene can have on reducing the burden of infectious disease, we really position this as a government responsibility. And we see that governments acknowledge this responsibility when there is an upsurge in infection risk. So when COVID-19 happens, all of a sudden government is providing temporary hand washing stations, and there's a big investment in promotion materials and really encouraging and supporting people to wash their hands more frequently, because we know it can curb transmission and therefore it can affect the community. We need to see that level of responsibility being taken by government also just in a non-emergency situation. So governments are encouraged within these guidelines to take on that responsibility and move beyond emergency-led approaches. The second point I think to flag is that, as I was mentioning a bit with the scoping review, here we provide evidence-based technical recommendations on a number of different aspects associated with hand hygiene, and in particular around the aspect of behavior change and really what drives behavior change. and what drives people to wash their hands. And we know that there are a number of different aspects, psychological, kind of cognitive aspects, environmental aspects, and social aspects that really drive any human behavior, and hand hygiene is no different. What the guidelines have been able to do through extensive literature review and through discussion with experts is identify core requirements, a small number of core requirements that we know are applicable and generalizable across the globe that would enable and drive hand hygiene. And so it really is the minimum requirements. So if governments are taking responsibility for this, what should they be ensuring is in place in every school, in every community space to enable the behavior? And thirdly, we advocate for systems-based approaches. So moving beyond short-termism, moving beyond this cycle that we see where there's a health emergency, which leads to rapid increase in investment in hand hygiene, and then that subsides and hand hygiene begins to be neglected again as that emergency disappears and as that increased health risk becomes less so. What we're advocating for in these guidelines is moving towards a systems-based approach where we're thinking about how can we build sustainable and resilient national systems that support hand hygiene service providers to provide the core requirements for hand hygiene at all times, and that can be scaled up as needed when an emergency occurs. So those are the three things that I would really like you to take away in terms of the core things. I do want to just flag, and I won't take long on this, but just to say that WHO follows a very rigorous process for developing global guidance and global guidelines. And that is the basis for the recommendations and the guidance in these guidelines. What we do is we scope we create a scope for the guidelines that really is based on extensive consultation with our end users, including member states and governments, member states and their partners, and also scoping based on what's already out there. So talked about that scoping review that we did. That's the first phase of work. And once you've scoped out the guidelines on what they're going to cover and what topics they need to hit, what questions they need to answer, the second phase is a thorough review of the evidence, and we carried a comprehensive review where we published 5 systematic reviews on different aspects of hand hygiene, which could inform the recommendations. And the third step that we take in guideline development at WHO is then to convene a group of independent experts that can weigh up the evidence that we've commissioned and also utilize their own expertise to arrive at these recommendations independently. And I've provided a link there for a BMJ Global Health supplement where we published all of those 5 systematic reviews, along with a couple of commentaries that we also produced that convey the level and extent of that consultation that we did with end users, which I would encourage you to look at. But moving then to the guidelines themselves, the focus of the guidelines, this pie chart, which you might call it, kind of outlines some of the key things, the key takeaways in terms of the focus and the scope. Firstly, as I emphasized very early on, we're looking at community settings. So we're not interested in these guidelines in particular not interested in hand hygiene in healthcare facilities or settings where their primary function is the delivery of healthcare. We're interested in community settings, and here we're thinking about the household. We're also thinking about communal spaces, so public plazas and restaurants and shopping malls and shopping centers and things like that. And then we're talking about institutional settings as well. So we're talking about schools, we're talking about workplaces, we're talking about prisons, we're talking about other institutional settings like that. The second thing to flag is that these guidelines are and should be relevant to any resource context, so low, middle, and high, and we've written them in a way that should be adaptable to those different contexts. We're much more focused on long-term development context within these guidelines. We know that the SPHERE guidelines provide guidance to anyone working in a complex emergency, in a situation where there's been in a fragile context where there's been war or humanitarian crisis. So we didn't need to focus on that. So these guidelines focus on long-term development context to be complementary. And finally, these guidelines are relevant both for routine public health contexts and for emergency public health contexts, as I was saying. And in fact, you'll see specific guidance relevant to health emergencies shaded in blue throughout the guidelines, really to help with signposting for that, if that's the particular reason why you're picking the guidelines up. And yes, just to flag here the community settings across those 3 different tiers. The second thing to say about the focus is that it really is centered on this theory of change, where at the top there we have our improved health outcomes. We talked about acute respiratory infections and diarrheal disease being key targets for improvement with hand hygiene, but there are, of course, others. And how we want to improve health outcomes is by achieving sustained practice of effective hand hygiene. And the way we want to do that, as I mentioned before, is by promoting and supporting governments to enable access to the core requirements for hand hygiene. We'll come into what those are a bit later. And in order for those core requirements to be available, it's this strong system for effective service delivery that's going to enable that. And the guidelines provide guidance on all of these aspects. So you've got the community settings, you've got the different parameters here, you've got your theory of change, and we can see here the recommendations that come out of each of these. So recommendation 1 is really around the policy, legal, regulatory, and fiscal measures required to promote hand hygiene, to create that system that provides strong services for delivery of hand hygiene products and materials. Recommendation 2 is around the effective materials, the technique, what key times are required for practicing hand hygiene in community settings. Recommendation 3 outlines what is required, what the core requirements are for practicing hand hygiene in community settings. And then the final chapter, chapter 5, talks about the government measures to strengthen hand hygiene systems and what they are in particular. So let's just look a little bit more in detail at these recommendations. 3 recommendations, as I say. The first, acknowledging hand hygiene as an important public health measure and recommending that governments promote the practice. And also, crucially, defining what promotion involves. So many of you, when you hear when you hear me say hand hygiene promotion, may be thinking about how governments and their partners might promote hand hygiene on Global Hand Washing Day once a year through certain promotional materials, or potentially how healthcare workers might be tasked with promoting hand hygiene as a part of a number of other behaviors, healthy behaviors that are being promoted. Actually, what we want to talk about here, when we talk about government's role in promoting hand hygiene, is promotion as in the broader context, in the broader sense of that word. So promoting it by providing people with the wherewithal, the materials that they require to wash their hands, not just by telling them that it's important to do so. Secondly, the second recommendation outlines how hand hygiene should best be practiced, so the technique, when it should be practiced, and with what. And the third outlines those core requirements, which we'll come to in a moment. So this is recommendation 1. Governments should implement policy, legal, regulatory, and fiscal measures to promote hand hygiene as a critical public health intervention. And these actions should aim to remove barriers to the practice of hand hygiene and strengthen the factors that enable behavior change or sustain practice. So you see here that definition of promotion that goes over and above providing information on the risks associated with not doing it. Recommendation 2 then is talking about what makes effective hand hygiene. Hand hygiene should be practiced with, we recommend 4 community settings that hand hygiene should be practiced with plain soap and water for enough time to enable covering both hands entirely with soap and thoroughly rubbing at key times when disease can be transmitted via hands. And we recommend that alcohol-based hand rub is an effective alternative to soap and water when hands are not visibly dirty. So those of you who work in the healthcare sector, and in healthcare facilities and in infection prevention and control will already have identified that this is a little bit different potentially to what you've seen for the healthcare setting. And that is deliberately so. That's not to say that alcohol-based hand rub is not extremely effective, especially in healthcare facilities. But in the community where often we see visibly soiled hands, we are recommending soap and water as a first thing. And you can see here the key times down here are all associated with the transmission routes of diarrheal disease and fecal oral diseases and respiratory diseases. So we can see that it's before preparing food, before eating or feeding or breastfeeding others, after using the toilet or handling feces, after coughing, sneezing, or blowing your nose, and also when hands are visibly dirty. Now, of course, there are a number of other moments when you might wish to wash your hands during the day. What these guidelines do is provide you with those key times. And it also emphasizes that there are some times during emergency response contexts where additional times may well be relevant. And they provide information on that. So upon entering private or public buildings and after caring for people who are sick, for example. And so some of the specifics on recommendation 2, I've already outlined that it's plain soap that we're recommending. We don't recommend antimicrobial soap due to potential harmful health and environmental impacts that we found information and evidence for in the literature. Of course, if it's the only available option, then washing your hands is the most important thing. So please do use antimicrobial soap. Secondly, on water, running or poured water from improved source where possible. And on microbial water quality, which, as you will recall, was one of the key areas that we saw there was a gap in existing global guidance. The evidence is incredibly poor in this area, but through the evidence review and through our expert consultation, we were able to identify that if microbial water quality is poor or unknown for hand washing is still recommended, provided it is with soap, and that hands should not be rinsed in a communal basin. Then just to flag again, we talked about alcohol-based hand rub being a recommended alternative, and we talk about the alcohol content and local production where possible. We also flagged that if soap is unavailable, water alone can achieve some benefit, but it won't be above the threshold required for effectiveness, but it is still preferable to no hand washing at all. And there are some alternatives that, after thorough review of the evidence and thorough discussion with our experts, we do not recommend. And this might actually be against some of the things that you feel you know based on existing guidance. So we don't recommend non-alcohol-based antiseptics. We don't recommend antimicrobial wipes or sand, soil, or ash. And just to flag, although these alternatives are not recommended under standard conditions, they may be used as a last resort during health emergency situations where there's a heightened risk of infection, disease transmission, and where there is no access to soap and water. On recommendation 3, so finally we arrive at those core requirements that I've mentioned a couple of times now. So what are those core requirements? What has the evidence told us that really can support driving behavior change and encouraging sustained behavior adoption? What are those things that are universally applicable across countries, across contexts? Well, of course, access to the minimum material needs. And I know that this is a very obvious point. You simply can't wash your hands if you don't have water and soap to do so. It does bear emphasizing because we know from experience that a lot of promotion activities across the globe don't focus sufficiently on this first point. And indeed, COVID-19 is a point in case where a number of contexts were encouraging their population to wash their hands more regularly. And actually, we know that millions of people simply don't have those basic materials. So the first core requirement is governments really need to take responsibility for ensuring that people have access to the minimum material needs. Secondly, they should ensure that there's access to information on when, why, and how, and also where to clean hands. And thirdly, and this one's an interesting one which we will unpack a bit more, there needs to be a conducive physical and social environment in order for that motivation to continue washing hands really to kick in. And we'll get into that in the next couple of slides. So On the specifics around the minimum material needs, it's really just to flag here that these need to be reliable, so they need to be available when needed. They need to be accessible, including to kids and those with limited mobility. And the amount needs to be sufficient, right? That you need to have enough soap and enough water for each hand washing event to cover the entire surface of your hands. And there's a rough guide that I've put here, which I won't have time to go into now. So this is really just the basic requirements. It doesn't talk about where these need to be located to encourage behavior change, what ratio of hand washing facility by population needs to be considered in order to enable and drive behavior change. These things are all covered in the conducive physical environment aspect. Here, we're really talking about what are those minimum material needs. Each household needs to have access to a basic hand washing facility that's reliable, accessible, and sufficient. In terms of the information and getting the basics right, we need to provide information on when, how, and why to practice hand hygiene. And those of you who work in this space may be questioning this a little bit, because there is this prevalent view that simply providing risk-based information or information on the health benefits associated with hand hygiene is not going to move the dial. It's not going to get people washing their hands routinely. And I think you'd probably be right. But even though it's not sufficient, it is a core requirement. People need to know the basic information in order to practice the behavior effectively. But then there is also this other aspect you see here, where we go from getting the basics right, from enabling hand hygiene, to actually encouraging and motivating it. And we need health promotion materials that are informed by behavioral data and evidence, that are supported by community engagement, by understanding of the audience, and that really address context-specific barriers and enablers and can move beyond just knowledge transfer to addressing those behavioral barriers that we've identified, addressing motivation, addressing emotional drivers, social influences, and behavioral drivers. And that really needs to be done in a context-specific way. Moving then to the final piece of these core requirements, the final piece of the puzzle, the conducive environment. As I was talking about earlier, the minimum material requirements or minimum material needs are really the very basic aspects. And here, when we're talking about the conducive physical environment, we're much more focused on aspects such as convenience, attractiveness, and ease of use, because these are the things that the evidence has shown us really can help drive behavioral adoption and sustained practice. If there is a convenient location for this hand hygiene facility, if it's located within reach or within view of the toilets or where food is prepared, cooked, and eaten, we're much more likely to wash our hands. If it's attractive, we're much more likely to wash our hands. And if it's easy to use, of course, the same applies. When it comes to the social environment, key characteristics of a conducive social environment, these are also incredibly important. We know and we can see the evidence for the power of having role models, of having visible role models that are practicing hand hygiene and championing that behavior. We know that there's a huge impact around positive reinforcement, and we can see this, for example, in schools and with children, but it applies across the piece. We know the power of collective routines and building hand hygiene into those. Of course, community engagement is incredibly important, as is addressing misconceptions, and in particular around cultural practices, where there are some, for example, some cultural practices which would encourage communal hand washing in one single basin. And so addressing misconceptions around that, or misconceptions around the use of alcohol-based hand rub or other things. These are things that need to be addressed in the information. And then just moving beyond to, so we've had our 3 recommendations, and just to tie off this question, this segment where I'm outlining what is in the guidelines, to flag that we also have a full chapter really going beyond just what needs to be in place to thinking about how we're going to implement this, how governments can ensure that they're supporting the access to core requirements for hand hygiene. Because it probably goes without saying, but even though the guidelines are putting hand hygiene squarely as a responsibility that government needs to think about, there's no question that a number of different actors need to be involved and have a role to play in ensuring that there are effective services that are delivering core requirements to people so that they can wash their hands routinely. It's not just the government who'll be doing these things, it's a number of actors, but government has that role of oversight and coordination to ensure that these services are being delivered, to ensure that all the system components function effectively together, and to empower actors to do their bit. And it's important to take this systems approach so that we're breaking that cycle of panic and neglect, where we're seeing a surge in attention after health crises, followed by extended periods of neglect. And in the next slide, you'll see the structure for this implementation guidance. What we did through collaboration with 10 champion governments who supported us to develop this guidance was to map out a simplified framework for thinking about this system that I'm talking about. What is a hand hygiene system? When we talk about a hand hygiene system, we're talking about all of the aspects that really sit upstream of those core requirements that we've provided recommendations on. So how can we ensure those core requirements are in place? Well, there are a number of services that deliver them. And how can we ensure strong services? Well, there's a huge aspect of enabling environment that the government's responsible for. And even though it's quite small, if you bear with me, you can see it here on the left. So our ultimate aim is sustained practice of effective hand hygiene. And we have our core requirements here in this box here: the minimum material needs, the information, and the conducive environment. These are things that we know are proven to drive and sustain behavior. And how can we ensure that in any community setting, whether it's a school or a restaurant, or in the household, that these things are available? Well, there's a number of services that need to be functioning effectively that will deliver infrastructure, they'll deliver products, they'll ensure ongoing operation and maintenance, and they'll also deliver health promotion materials. And how can we ensure that these services are effective and up and running and are supported? They require a strong enabling environment. And typically, the responsibility of government sits here in the enabling environment, in ensuring that there's robust governance, so that there are policies and strategies in place, but also that there are regulatory frameworks and processes for enforcing these, so that service providers know the system within which they operate, and there are rules and checks and balances. Also, that there is data and information, that there are strong monitoring systems for hand hygiene, that there's enough and sufficient financing across the piece, that there are that there is capacity across the system to deliver on the different aspects. And also there's this aspect of innovation and really driving innovation in health and in hand hygiene. And I won't dwell on these, but just to say that these different aspects are also underpin the enabling environment, underpin services, and underpin core requirements in turn. There are institutional factors and structural factors. These are things that we don't necessarily have control on as we're developing our hand hygiene program and our system strengthening plan, but they are things that we need to be aware of as we do that. And on the right-hand side, it really just flags up for you the number of different actors who have a role to play within this system. At the bottom here in blue, we can see we've sort of split those service providers into three in a simplified, this is all really a simplified framework. The extent to which it applies to your specific context really needs to be analysed and evaluated. But these three different buckets of services, so there are customer services providing sales of hand hygiene products, but also producing health promotion materials to support in their marketing. There are public services, and here we're typically talking about, water network connections, and also health promotion materials through the health service. And then, of course, there's infrastructure, where we need to acknowledge that in order for minimum material needs to be in place for hand hygiene, there is a huge element of water supply, and so extension of water networks plays a part as well. And above this, we kind of the local administration functions. So whether it's a school body, in a school setting, for example, this would be the school governing body. So what role does the school governing body have in ensuring that kids in their school are washing their hands? We have the service providers below them, that's true, but what's their role? And here we've listed out the different things that at the governing level would be responsible. And this would be true also at the household level. So the head of the house, what would they be responsible for doing? Then we have local government functions, and then we have national government functions up here, which I've mentioned a bit already. So I'm just put this slide up here again, just as a quick reminder of those three things that I really hope you can take away with you today, and I hope will encourage you to look at the guidelines in your own time. This emphasis on government responsibility, not to do everything, but to coordinate and have that oversight, moving hand hygiene from a private to a public good. This advocating for a systems-based approach, moving beyond short-termism, thinking about resilient national systems, and this provision of really quite detailed evidence-based technical guidance to fill gaps and resolve discordance on what enables and drives behaviour. And before I hand back to Claire, I just want to flag that since we published the guidelines in October last year, we've been working with our champion countries, with a subset of our champion countries, I should say, to support us as we pilot how we move from that system framework that I just showed you on the screen to actually implementing in countries and identifying how best to do that. We're lucky in that we have this partnership with our 10 countries who co-designed our implementation guidance. They co-designed that system framework that you see, pardon me, in chapter 5, and are now ready to integrate those recommendations into relevant areas of work. And if you're listening and you think this could be you, and you're working in a government that wants to really take hand hygiene seriously and make a difference, then please do be in touch, and we'd be more than happy to provide all the support we can. Back to you, Claire.
Thanks very much, Jo. I'm going to come back to you in a second, but let me just move through to close off the slides for today's class. Thank you once again. This teleclass was presented by IFIC as part of the IFIC 2026 IPC Masterclass series. We're really grateful to Weber Training for having us with him this year in his 25-year anniversary of Weber teleclasses. These classes throughout the year, both as part of the Weber class series and as of this IFIC Masterclass, are maximum 1 hour free to access sessions by leading infection prevention and wider aspects experts. And it is such a great opportunity. These classes reach such a wide audience. And although we don't have interactive Q&A at the end, we do have you all stimulated, and we are a community together as part of these classes. And if you'd like to join IFIC, you can be part of another global network advancing infection prevention and control. The membership connects you to a whole host of other people, resources, and IPC societies. Full membership of IFIC is actually available to societies, associations, and organisations, but there is also individual membership open to professionals, of which I'm one of those members. So when we think about the IFIC Masterclass series, you can mark your calendar for classes supported by Weber Teleclass, but with IFIC on May 14th on publishing, June 23rd on the role of the environment, July 23rd on national and local IPC improvement steps, August 13th, our role in preventing infections across borders, and many more. You'll hear all about them later. And Weber Teleclass has a number of other sessions coming up. It really is an exciting agenda for this year. On 5th of May, there'll be a special class for World Hand Hygiene Day with myself and Mandy Deves from the World Health Organization. And then you can see here there are other classes in May, including on patient safety, and excitingly coming live from IPAC Canada conference, one example there on environmental stewardship. So nice way to close off and to excite people, not just on today's class, but also on many others to come. And Weber Teleclass likes to thank some of their sponsors, Diversity, Virox, and indeed IFIC. And that's Sponsorship and that support comes in a range of different forms, including promotion and contributing to the classes, as IFIC is doing this year. So, Jo, I just want to come back on a few things now that the formalities are over. As you can imagine, I'm like totally enthused and stimulated, even though I was privileged to be a small part of reviewing and contributing to those guidelines. Really passionate about the subject. And a couple of reflections from my side first. It takes me back, of course, to when we started with World Hand Hygiene Day on 5th of May, and how that was complementary to Global Hand Washing Day, which is in October, 10th October. And we started them at the same time, 18 years ago. They were launched, but they had different goals. Professor Val Curtis from LSHTM had been passionate for years about those diarrheal diseases and the community impact and how the action of hand washing could really make a difference. And of course, colleagues, myself and colleagues, were looking at that healthcare agenda, avoidable infections, and what hand hygiene can really do there to save lives. So to me, these agendas have always been so complementary. And any advertising is good advertising, as they say. So it's a great opportunity to just raise the profile overall of hand hygiene, hand washing, whatever it may be, because we know that it still doesn't have the commitment it needs. Jo, you mentioned a few things that sort of sum up global commitment: documents, regulation, reporting and progress, advocacy, that this really is a human right that we should all be afforded, evidence reviews, which you presented very clearly through this work of the guidelines, that there are minimum requirements that we should at least achieve. So that was a range of things I heard today, but if you were to add one other thing or say what one thing might make that difference, what do you think it would be out of all those things that were presented?
That's a very good question, Claire, and it's something that we're grappling with every day at the moment as we work with our champion governments who have committed to implementing these guidelines in their countries, and knowing that every government at the moment in particular, possibly, but in general, has a number of competing priorities, and that it's very difficult to prioritize everything and to fund everything, right? And so what we're grappling with is exactly this question that you ask: well, what's that thing? What's the most important thing that could really drive this agenda where we could sort of see that change that we so desperately want to see? And I think with the countries we're working in at the moment, so in Ethiopia and in Nepal, we're really seeing this interest from government to not try and make hand hygiene a priority above all of these other priorities, but really tie hand hygiene to existing priorities and government pushes, whether it's maternal and child health, reducing preventable deaths or eliminating preventable deaths, whether it's looking at economic development and the role that schools and child education has in that, and tying hand hygiene to these broader agendas where there is a groundswell of support and where the value is perhaps more implicitly understood, because hand hygiene is a cornerstone of public health, and public health is a cornerstone of a number of other things. So I think it's about building that case. It's about building that narrative about how hand hygiene can and should be a solution or part of the solution to something that you're already interested in, rather than one more thing you have to add to your long list of things to prioritize and fund. And so for a very concrete example, in a country like Ethiopia, which is struggling with a resurgence and continued outbreaks of cholera, we can see the impact that hand hygiene could have on that area of work. And of course, it is already included in cholera, in strategies for cholera elimination, but the extent to which it's really given the necessary investment and support, I think, is a question mark. And what the guidelines can do is support governments to think very strategically about how these broader programs, whether it's cholera or whether it's wash in schools or whether it's broader education programs, how they can champion hand hygiene. And this might be something simple like ensuring that there's a dedicated monitoring indicator within a broader framework that looks at hand hygiene, or ensuring that there's a dedicated budget line in a broader budget. These are things that I think would really make the difference. And they don't need to be massive changes or massive things, but it's more about identifying where that leverage and that catalytic change can occur. I hope that answers your question.
Yeah, no, thanks. Really insightful, Jo. And I want to say a few more comments and then just one more question. But you really are a true advocate yourself, and it's inspiring to hear those words. And I think some other key words I heard, of course, systems-based approaches. None of us can disagree with that. Sustainable and resilient is so key. That is core to our whole planet right now as such. And we talk a lot about surge strategies to be able to cope with different situations. So I liked when you talked about that. Of course, I was aware of the recommendations, but again, I want to emphasize how much they complement the hand hygiene and healthcare guidance. It's refreshing to hear some reinforcement of some of the messages that, those guidelines will be coming up 20 years old for healthcare, but to hear the evidence and reinforcing some of the areas that cross over both guidance, including things like not having to use antimicrobial soap. That certainly was never a recommendation. And I also like you talking about the role of actors. So back to role modeling and advocacy, as I just said, the role of different actors, I think, so critical to implementation. We're constantly encouraging stakeholder analysis so that our efforts for improvement can be targeted. And if you don't do that, and another key word you used, co-design, if you don't do these things, your implementation is going to be more and more challenging. And I think that the examples of the implementation insights around convenience, attractiveness, and ease of use just make sense. Now, 3 phrases, and it's not as simple as that when you want to actually achieve it and sustain it, but really, really clear. And again, as I say, complements. And I think that the interesting one of the situations you mentioned was prisons. And indeed, we have many infection preventionists who have to cover prison settings and have to really adapt the hand hygiene and healthcare guidance to suit these very different institutions. So again, I think that complementary nature of the guidance is brilliant. So on our Warming Up for World Hand Hygiene Day webinar, WHO's webinar last week, we really did drill into role models and their role in implementation. And I want to just ask you maybe just to give one more example of the work you're doing with people. What kind of actors are rising to the fore as role models? And secondly, really interested to hear, how are you reaching the governments, and that ties to role models? And finally, how will you monitor no progress is being made?
Thanks, Claire. Well, on this question of role models, so you'll have seen that it's part of our framework, right, for understanding what drives and sustains behavior. It's part of that conducive social environment. And so those role models can and should be found everywhere, right? Like in my house, I role model hand washing to my children every day. Not sure how much of a difference it makes, but I do it. And at the school setting, we really need school teachers to be doing that as part of also communal routines. We need the head teacher to be doing that. And we need, evidence shows that we really need this to be made a fuss over, and that for people to realize that it is an important thing to be role modeling and to be doing, not just on Global Hand Washing Day, but routinely and as a part of the course. And I think when it comes to government role models and political leadership, Our guidelines really emphasize the need for this. And sometimes it might feel like a hopeless thing. As I said, there are so many competing priorities, but we see examples of this across the globe, of governments that are really championing the clean, green agenda, really. And of course, this is about environmental health more broadly, but hand hygiene is a key component of that. And we see it in a number of countries where it's being championed at the presidential level. And I think that's really what we're talking about here. And it doesn't need to be championed at the presidential or ministerial level by someone championing hand hygiene specifically, but as part of a broader agenda, an agenda for development, for social and economic development, which we know historically does require environmental and development and health. And these are all things that are interconnected and linked. So I think it's about finding those linkages and really emphasizing the gains from having that political leadership. When you talk about monitoring, I think that's a really, really key part. As you know, and as I mentioned, the joint monitoring program that WHO and UNICEF lead is responsible for monitoring that one indicator as part of the broader Sustainable Development Goals framework, that households, actually it's a couple of indicators because schools are also there, that households and schools would have access to basic hand washing facilities by 2030. So if nothing else, we can see and monitor progress of implementation of the guidelines through that. But we are also developing our own tools, because acknowledging that there is a need, I think, to get into the weeds on this. So if we're thinking about what is a system, then how can we monitor that system? How can we create a baseline assessment of the existing system in a country and then identify where potentially the successes are and where they're potentially falling short, and then develop an action plan? And at the moment, we're in the process of developing a toolkit that would support anyone interested in taking this up to do that baseline assessment, and then to carry that through to developing an action plan for system strengthening and continual monitoring through this tool as well. And you'll see that published as a pilot version in Global Hand Washing Day of this year, where we hope to also have a series of case studies from Nepal and Ethiopia, as I mentioned, and hopefully a few other countries who have given this a go in their own context as well, to inspire others to do the same.
Oh, brilliant, Jo. We should close now. We could talk all day. I know we love to share these ideas together, but I think a lot more to come from both our sectors, healthcare and these other non-healthcare institutions, organisations, and a lot of learning. And as I say, the stimulation and refresh for the healthcare sector is amazing, and that crossover is really welcomed. And we wish you well for the next efforts. We will look forward to both World Hand Hygiene Day in May and Global Hand Washing Day in October. Thanks once again, Jo, and to Weber Teleclass.